Hello, everyone. I'm Dr. Ngai, a founding member and Director of Immigrant, Culture, and Linguistic Studies at the Institute for Health Equity Research, IHER. Today, I'm here to share with you my view on a crucial topic of healthcare research, engaging patients with limited English proficiency, LEP. As of 2022, the U.S. immigrant population stood at 47 million, constituting 14.3% of our population, and this number is expected to double in the next 4 decades. Census data reveals that people in US communicate in over 350 languages. That posed the first challenge in recruiting LEP patients, obviously, is the communication barriers. From my personal experience working at a tertiary care center in New York City, even though a quarter of my patients have LEP, when it comes to research recruits, most research projects only recruit patients who can speak English, with some occasional studies in Spanish. To give you a perspective of the extent of the challenge, one big research project that is run by NIH currently called All of Us Research Program. The goal of this program is to recruit 1 million participants across the country since 2018. However, they only have Spanish and English in their printed materials as of currently in 2024. Therefore, only Spanish and English patients could be recruited. I have two suggestions in potential solutions to this problem. One, when designing your research team, have a multilingual support team. That being said, it is imperative. Having a bilingual staff can definitely facilitate communication between researchers as well as research subjects. If that is not possible, for the very least, the team should be familiar in the usage of interpreter service at your hospital or recruiting sites. Second, have a target specific minority group. That is, the location of your institution dictates which language is most important to you and your research. Using my hospital system as an example, one of our community hospitals is located in South Brooklyn that sees a large population of Polish or Russian immigrants. Therefore, when we design our research studies, we actually tend to oversample Polish and Russian patients in that area. The second major challenge in engaging LEP patients for research is cultural sensitivity. Different cultural backgrounds require a tailored approach to recruitment and engagement. One example of this is among Chinese speakers, which is a big population in New York City. There are subgroups that use different apps. For example, immigrants from mainland China would use WeChat, while immigrants from Taiwan, China would be using Line, and patients from Hong Kong area would be using WhatsApp. So my suggestion actually is to have engagement with community leadership. Involving community leaders in research initiatives can enhance cultural understanding and acceptance of the research practice. 5 additional areas that I would caution researchers to consider include: 1, your local language access policies of the institution. 2, do you have enough training for your team member as well as the PI? 3, use of plain language that would both facilitate the recruiter as well as the participants. 4, an inclusive recruitment strategies. And finally, a flexible research procedures. In conclusion, engaging LEP patients in research requires a multifaceted approach that addresses communication barriers, cultural sensitivities, and systemic challenges. By implementing strategies such as multilingual support teams, community engagement, and inclusive recruitment practices, we can ensure that research is inclusive and representative of all populations. Thank you for watching, and let's continue working together to make healthcare research more accessible and equitable for everyone. Thank you.